Dr. Dan Michaels with the Reconstructive Foot and Ankle Institute, and one of the most common things we see in our practice is skin cancer. There are the biggest organ in the body is skin, and we evaluate skin every day. And I can't tell you the number of times I've taken malignant melanoma off a foot, and the patient just came from a dermatologist who did a whole body check, and they left malignant melanoma on the skin. So it's really common. This happens a lot. And so any kind of skin lesion, any kind of change in your skin or a new growth needs to be evaluated. And below the knee, we take care of the skin below the knee. So since we're foot and ankle specialists, we see this all the time. We have various instruments that we use. So dermoscopy, this is a dermatoscope. And basically you look at, it's a magnifying glass, and there's lights. And these lights, they change. They let you look underneath the skin. You can definitely change the different lights on here. And you can look at a lesion and evaluate a lesion very well with something like this. It just goes on the skin, and you can look, and you can magnify by about 10x, 10 times. And that allows you to see all kinds of surface problems with skin. There's another device we use. It's just a regular magnifying glass with ultraviolet light that comes off. And this allows the skin to be illuminated in a different way. And so you can see different things on the skin with this kind of light. So using both of these, we can determine a great deal about a possible problem with a skin lesion. And if we do see something like that, then it's imperative that we take a little piece of skin off and send it off to the lab. And that's a small procedure that we can do here in the office. We take a little piece of that skin that's bad and we put it in a little container with formalin, which is a preservative, and then that's shipped off to our lab, and they look at, the doctors there look at that underneath a microscope and make a diagnosis. And we get that back and we discuss that with you. And if it's a problem, then we treat the problem. If it's not a problem, then we tell you that too. So the skin is very important, and we look at it every hour of every day. And I can't tell you the number of times that we've taken off these cancers on the skin. It's the most prevalent cancer there is. As a matter of fact, basal cell carcinoma is a type of skin cancer, and it's more common than every other type of cancer combined. So it's very important to come in and get your skin lesions checked, either with a dermatologist or if it's on the foot with us. But the skin is very important, and these cancers are curable, they're preventable. This is not hard stuff. After we're done, if you need a biopsy, after we're done, you put your shoes on and you walk out of here. There's really no downside, and it doesn't hurt. So by all means, if you have something of concern on your skin, please come in to have it checked.